This is a summary of a before and after study looking at the effect of a bridge on the American Tobacco Trail in the Triangle region in the central part of North Carolina. And this is studying the economic, health, and transportation impacts for completing this critical link in a 22-mile rail trail. So to give a little perspective where we are, this trail begins or ends, depending on your perspective, in downtown Durham. It passes over I-40 and then goes into Chatham County in the southern segment, and this is the American Tobacco Trail. And again, the goal is to before and after study. You see the green portion here in the map, and this is the bridge and the connecting trails that tie together the northern segment and the southern segment. So the objective was to study what effect this bridge had on users and how they use the trail, health, economy, and their transportation effects. So to complete this study, we set up survey and count stations along the trail. So on the left picture here, we have people completing the survey. We have a full map of the entire trail so people could look and find names to key points along the trail. We did also have a water refilling station to attract people to come over and fill out the survey, and we set up signs, and we had chalk on the trail as well to encourage people to help make the trail count. And the image on the right, we have a count station, and this is just someone just literally counting modes and number of people that are crossing a particular location. Now, looking at some of the values for these count and survey locations. So our study periods for the before was in 2013, and 2014 was our after period. So in total, the counts went from 9,000 to over 21,000, and some of this is just a reflection of having an additional count station. So this is where the surveys really come in and help understand how many unique, or estimate how many unique individuals were using the trail. So the survey change was from 1,300 completed surveys to over 2,200 completed surveys in the after period. And now summarizing this information a little further to try to get to the estimate in the number of annual trips. So we did collect these counts at various locations, and we had our round trip adjustment factor based on the surveys, and we came up with our, and this is just an example for Saturday, our weekend day, went from 810 unique users in the before period in 2013 and almost 1,900 in 2014, which corresponds to an annual estimated number of trips of around 218,000 in the before period to over 508,000 in the after period. And again, these adjustments were made using the survey data and applying it to the count data. So a little more details on our data collection, the before and after period. We added an extra count and an extra survey location in the after period, and these were the locations that were actually right at the bridge. So we wanted a station there to really determine what effect that bridge had. A huge amount of people were involved in this, 40 in the before period, 28 in the after period. We had kind of people working longer shifts in the after period as well. We had fewer people. And we essentially worked from counting and doing surveys from daylight until dark. So 4 days of data collection in each and 13 hours per day. So very long days, but very effective. We got a lot of great information from this data collection. So this is looking at some Garmin data from 2013. And I think what's interesting here and what we're calling out here is you can clearly see there's a break in travel. So here's I-40 that served as an effective barrier. The interchanges nearby didn't have and don't have great pedestrian facilities. And so it really was a barrier between these portions of the trail. People weren't making that connection. And this is the after period, so we're looking at the same type of information. This is though from Strava, but similarly looking at how people travel in non-motorized modes. And here we actually can see that bridge connection. We see people are making that trip over I-40, still not using one of the adjacent interchanges, but we do see there are some likely bicyclists who are using the other adjacent interchange, but nothing to the extent that we see using the pedestrian bicycle bridge that was part of this study. So a little bit of some of the results. So this is the before data looking at the user profile, the activity on the trail, roughly split into kind of thirds. So about a third jogging and running, about a third walking, and a third biking. And there are some other modes like rollerblading, roller skates, skateboards that fit into those all other modes. One of the things we saw from 2013 to 2014 is a further geographic spread of those users. So more people now, instead of seeing it as two shorter independent trails, seeing it as one longer trail. And we did hear that anecdotally from a number of people saying they wanted to come and ride a really long trail. 22 miles is one way is a long distance. So certainly anybody looking to travel a long distance on a separated bicycle or pedestrian path has a great option with the American Tobacco Trail. Some more results. So again, we talked about that approximately 200,000 trips in 2013, jumping to over 500,000 in 2014, 133% increase based on the installation of the bridge. The annual expenditures from users support an additional 43 jobs, 1.3 million in wages, and almost 5 million in business revenue from this before to the after period. Trail users increased their activity to 162 minutes per week, which does meet the recommended guidelines for moderate intensity physical activity. Because of the increase in activity and users, people now burn 175 million more calories, which is an annual increase of 163%. And this is perhaps my favorite statistic out of any project I've worked on. Those calories burned were the equivalent of about 19,000 cheeseburgers weekly by these travelers. So I thought that that little stat is interesting and very unique for the research that I've been a part of. And we can see changes in those calorie expenditures have a huge role on the bicyclists, and this is largely because making that connection allows those bicyclists who typically will want to and are capable of traveling longer distances to make those longer trips on the American Tobacco Trail. But we do see it across other user groups, the runners and walkers who are adding distance based on this connection on the Greenway. Here's looking at that same type of information, just looking at the mode. We see across all modes there is an increase from an average of 7.3 miles to 9.3 miles. That's the average, of course, is brought up by the bicyclists, which is a 27% increase overall. So some of our key findings from the study: the average distance travel increased by an average of nearly 3 miles for bicyclists and half a mile for pedestrians. The duration of users went from 138 to 162 minutes per week. An additional 3.7 million is spent on an annual basis on goods and services by those using the trail since the bridge was completed. And those overall economic impacts for the trail use: 43 additional jobs, 1.3 million in wages, and almost 5 million in business revenues annually. A great team worked on this with some amazing sponsors who all came together to make this study happen. It's rare that we actually get to study something in advance and get that before data that's actually very, very valuable for us to be able to understand what difference a project made. So thrilled that we could work with these partners and this team at ITRE at NC State to get the before data, and then go back afterwards to get the after data and really see what that effect of this connective bridge had.